Good evening, everybody. I welcome you all to this exclusive Kidney Care Talk Show, an initiative by Integrated Health and Wellbeing Council, powered by JB Chemicals and Pharmaceuticals. I am Dr. Asavri Sawant, Public Health Specialist at IHW Council, and in this live session, we will dive deep into the topic of diabetes and kidney health. According to the most recent estimates published in the Diabetes Atlas 2021, India accounts for 1 in 7 of all adults living with diabetes in the world. The number of people living with diabetes is predicted to increase by 69%, that is to 152 million by 2045. It is alarming to note that over 1 in 2, that is 51.2% adults living with diabetes are undiagnosed. And diabetes is responsible for 747,000 deaths in 2021 alone. So it is very clear that unmanaged diabetes not only affects the pancreas, but other organs, including kidneys, greatly. The aim of today's talk show is to impart expert guidance on the topic of diabetes affecting kidney health, for which we have here with us an expert guest, Dr. Atanu Pal. Dr. Pal is MBBS, MD, and DM in nephrology and is the consultant nephrologist and transplant physician at Bellevue Clinic, Kolkata. He's the assistant professor for nephrology and ex-assistant professor for rheumatology at Institute of Postgraduate Medical Education and Research and Seth Shukla Karni Memorial Hospital, Kolkata. Dr. Danupal, we welcome you to the show.
Thank you. Thank you very much for the kind introduction. And this is my pleasure to be present here to discuss very important thing. Rather, I would say it is the most important thing for the today's perspective. So we'll discuss today whatever the current problem the patient are facing or the public want to know. So I'm on.
Great, sir. Thank you so much for coming to the show. So the topic for today is diabetes and kidney health. But let us start with the basics for public health awareness. So can you please throw light on how does diabetes cause diseases in kidneys?
Okay. So if we consider this diabetes as a killer disease, so that actually kills each and every part, probably each and every part of our body. So the kidney is not the exception, and the way that that it kills, there is some models that are there. The one model I can say is the Mogensen's hypothesis. So I'm not going in detail in that that is a medical terminology. But the thing is that it's a prototype that if you consider diabetes, the diabetes can be grossly divided into two. One is type 1 diabetes, and another is the type 2 diabetes. The type 1 diabetes is earlier was called as the insulin-dependent diabetes mellitus, and the type 2 is the non-insulin-dependent diabetes mellitus. But the nomenclature has been changed because lots of overlapping we have seen for the last few decades. Now, if we say that grossly, the type 1 is the prototype of the diabetes, then it actually takes around 20 years to develop kidney disease in an average. But there are some other exceptions where the patient may develop kidney disease even means the end stage kidney disease within say 10 years. So there are lots of other factors there. So initially there is when the sugar is not controlled, then it affects the kidney. Then kidney's membrane becomes thickened because of the deposition of the different glycated materials. That is, the sugar is metabolized in different toxic form, and that gets deposited in the kidney. So the membrane are becoming thickened, and after that there is a problem in the filtration. So there is the leakiness in the membrane. So the proteins starts getting into the urine, and so whenever more and more proteins are coming into the urine, the toxicity develops, and ultimately the patient will gradually lands up into the renal dysfunction, that is the CKD. So once it is CKD, it is a relentless progression. So there are 5 stages of CKD in a nutshell. So stage 1 to stage 5, when the stage 5 actually you require a dialysis. So when a patient enters into the stage 2 or more CKD stages, in that case, ultimately they usually land up into the ESRD. So one after another, the stage process. So starting from 0, you will have diabetic nephropathy, stage 1 CKD. Then 5 to 10 years, you will have stage 2 CKD to stage 3 CKD. In 5 to 10 to 15 years, you will have 3 to 4 and then 5. Ultimately, in the 20 years time period, usually you land up in chronic kidney disease, end-stage renal disease, where you will require either dialysis or transplantation for the survival. So this is by which the kidney is getting affected by diabetes.
Thank you so much, sir, for explaining that. Also, would like to know if diabetic kidney disease and diabetic nephropathy, are these two same? If so, can you please touch upon that as well?
Okay, so this is probably an MBBS question. So diabetic kidney disease is a spectrum of the disease. So diabetic nephropathy and the diabetic kidney disease can be interchanged, but very precisely when there is no renal dysfunction, when the renal dysfunction is not there, that means creatinine is still normal. Till that time, we actually say it's a diabetic nephropathy, but practically the term is not literally it's not that term correct. So when the patient is affected, the kidney is affected by the diabetes, then it's called diabetic nephropathy. And diabetic nephropathy ultimately leads to end-stage renal disease. This total progression, you can call it diabetic kidney disease. So it can be interchangeably used, the diabetic nephropathy or the diabetic kidney disease.
Okay, thank you so much for explaining that, sir. So, can you please highlight what is the actual prevalence or the burden of diabetic nephropathy in India? How many people who suffer from kidney diseases is because they have unmanaged diabetes? Can you please touch upon?
So you have more or less told about the prevalence of diabetes, the incidence of the diabetes in India. And if you look at the figure for the last say 20 years only, the India is gradually became the capital of the diabetes throughout the world. And so the prevalence of diabetic kidney disease in all diabetic patients, it is around 50% to 60%. So out of all diabetic patients, around 50 to 60% patient will develop diabetic kidney disease. And the most important problem in India is that the younger population are getting more and more affected by this diabetic kidney disease, and that they are developing diabetic kidney disease below 40, which is really not common in other parts of the world, particularly the developed countries. And if you consider the countries like India, where the economic growth is still not that much in comparison to the developed countries, there the management, the cost incurred is really very high in comparison to our total income. So if you have a diabetic kidney disease and that's landed up into CKD on renal disease, means ESRD, the patient is on either dialysis or transplantation. Particularly if we consider dialysis, then the cost of therapy would be around 30,000 in an average in Indian population. So say a particular person who is actually active and who is earning money for a particular family, and he got gets affected by diabetic kidney disease and lands up in the ESRD, the earning member will be lost. And so the total economic burden you can consider, this is 30,000, at least 20 to 30,000 per month you need to have means expenditure for the particular treatment. And so your earning has totally become abundant. So you can consider the misery of the particular family. So if the person is around 40 years, then or 30 years, if you consider for the example, then the total productive life of the patient will be totally hampered, and so the family again would suffer. So the social life, the family life, the productive life, all are totally ruined by this devastating disease. So it is very, very important for us to be very much cautious and careful about the disease, that diabetes. And from very beginning, if we can have the most of all, the first thing is that we have to we have to have detection of this diabetes, that you are having diabetes and you are suffering from diabetes. So this is first to be detected. After that, when the diabetes is detected, then the diabetes control is very, very important. That we'll discuss later on, but I'm just giving you a brief outline. So after that, when your diabetes is detected, then usually it is seen that the hypertension goes neck to neck with the diabetes as the diabetes advances. So the control of hypertension is also very, very important, particularly in the later part of the disease. So the control of the hypertension, control of the diabetes to the target that you set, and after that you can control this disease progression to the end-stage renal disease. So this is very, very important, that if you consider the number of population that we are actually India is producing, and it will produce in recent future, the India will be again the epicenter for the diabetic kidney disease and dialysis requiring or the transplant requiring patient throughout the world. So this is very, very alarming, that the government as well as the non-government and with the doctors, individual, and actually who are dealing with this diabetes or working on the diabetes, they all should tie their hands together to increase the awareness among the people.
Yes, sir, definitely. Very rightly said that awareness around this topic is very important, as well as different health communities coming together on this subject matter is also very important. So, sir, as we are also here for spreading the awareness around this, so can you please highlight what would be the risk factors? What are what are the chances of developing, a diabetic kidney disease, and how do they increase, and what can be done to avoid those risk factors?
So you have two parts in your question. One is the risk factors for the development of diabetic kidney disease, and then how to control that. So for the first part, so the risk factors can be divided into two. One is called modifiable risk factors, and other is called non-modifiable risk factors. Say you are Indians and you are having the chance of development of diabetic kidney disease is higher than that of an American. So you cannot modify it. So being an Indian, being an African American, these are the races where you cannot modify your risk factors. Likewise, if your family members are suffering from diabetes, then the chance of getting diabetes and the diabetic kidney disease is high in the particular population. And there are certain genetic factors. I'm not going in detail of that. There are some diseases where the chance of development of diabetic kidney disease is very, very high. And there are other non-modifiable factors, like when the patient is having other diseases, like I say cancer or other disease, where you need to treat the disease, this particular aggressive disease, and there is chance of more uncontrolled diabetes. In that case, you cannot modify that. So those are the factors where the non-modifiable factors are there. But the modifiable factors are very, very important, where you can have your control. So the first and foremost thing is the diabetes control. So set for normal population, if the HbA1c level, if you target is less than 6.5, or in a younger population, you can control the target set is less than 6, then it's very, very important that that target should be at least achieved, so that you can control your diabetic kidney disease development. Number two is, again, I mentioned there is a hypertension. So if the hypertension is there, then the hypertension should be controlled in the range that a particular your physician is set. So likewise, means usually we say that it should be kept below 140 and 90. But there are certain situations where if the patient is having protein in the urine, protein excretion in the urine, in that case the target is actually set much lower than that. And the target should be around 135 and 80, less than that. So this target hypertension should be achieved. Number three, if you are having some addictions like smoking, the smoking increases the chance of development of the progression of the diabetic kidney disease. So the smoking should be avoided. The alcohol consumption, that if you're there, then alcohol consumption should be limited, say around 120 to 180 ml per day you can consume. But now nowadays it is told that no limit, no minimum amount value is there, which is safe for the for your physique. Next is over-the-counter drugs. Say you are having some pain in your body, so you are just taking medications like NSAIDs from the over-the-counter and getting your diabetes more damaged, and the kidney would be more affected on the top of diabetic kidney disease. And say some Ayurvedic medications or the homeopathic medications where the heavy metals are used, and you are having diabetic kidney disease, and you are taking those heavy metals containing medications or alternative medications, whatever, then the chance of development of this and the progression of the kidney disease will be more. Then, if you are suffering from, say, fever, you are taking antibiotics. Those antibiotics sometimes may cause severe damage to the kidney. So always, whenever you need to have some medication, always you consult your physician to avoid these different risk factors to cause the damage to the kidneys. Next, if you consider the risk factor, that the modifiable risk factors like your lipid profile. So when you are having dyslipidemia, that the cholesterol level is high, you consult definitely to your physician to minimize its effect. Then, if you are having some other risk factors like say sometimes the patient develop different types of infections, and when disease is progressing, then the control of infection is very important. Otherwise, say pyelonephritis means when the kidney is affected by infection, that is called pyelonephritis. That should be treated very aggressively. Otherwise, in a damaged kidney, particularly in the diabetic kidney disease, it is progressed very fast to end-stage renal disease. So, likewise, there are different other risk factors that we can discuss in future if you ask some questions.
Thank you so much, sir, for so explicitly explaining all the different risk factors. So, my next doubt is that most people with diabetic kidney disease do not see any symptoms initially for some time. And the only way to know if you have diabetic kidney disease is to get your kidneys checked. So, can you please share the signs and symptoms that people should be aware of for both early stage and late stage detection, so that people, if they are come across any of this sign, they know that they need to go and get checked?
Okay, so this is particularly for the diabetic kidney disease, right? Okay, so one thing I actually missed that is very important, that is the obesity and the exercise. So in today's life, the obesity you need to control, because the changing scenario of the epidemiologic, the economic status of our country, we are gradually going from a thinner person to the thicker person, a more obese person. And whenever you are having more obese person, more insulin resistance and more diabetes related complications, and that's so the diabetic nephropathy development is very common in the obese population. So obesity, you need to control the modification of the diet, which contains more fruits, more of your vegetables that should be taken, and should avoid the junk foods more commonly, and you should cut down your salt from extra salt from your diet. So this is very important, that you should control your obesity. And so exercise is also very important to prevent the progression or prevent the development of the diabetic nephropathy. So this is the earlier question. Actually, I missed this part. So the next question was how to understand or how to detect that you are having diabetic kidney disease. So we are having very limited number of detection material to identify that you are suffering from diabetic kidney disease. So one is the protein excretion from the urine, that is called either microalbuminuria or macroalbuminuria. The terminology has been changed, but still we are using that. So when your urine contains more than 30 milligram per day of urine, means protein, then it's called albuminuria. So when it crosses more than 300 milligram, then it's called macroalbuminuria. And it is said that when it is more than 300 milligram per day excretion of albumin in the urine, that means your kidney is irreversibly damaged by the diabetic kidney disease. So it is said, but there are some exceptions also. So the first and foremost thing to identify whether you are having diabetic kidney disease is the excretion, albumin excretion in the urine. So your physician will ask for urine estimation, either 24 hours urine collection and urine protein measurement, or there is another method is available that is called urine albumin creatinine ratio or albumin protein creatinine ratio. So whatever method is available in your locality and which is standardized as per your doctor will ask for, and you have to go for that. So in the very early period, you can detect that you are having diabetic kidney disease by this detection. And when the creatinine level is actually high, that means it starts rising when there is significant damage in your kidney. So whenever there is significant damage in your kidney, the creatinine level will high up, and you will see that the creatinine level gradually creeping up from 1.3, 1.6, 1.9 to 2.5. After that, ultimately the patient will reach to ESRD. So now the creatinine level actually is changed to EGFR value. So now the laboratories are also well aware about this EGFR, and this EGFR can be calculated by your estimated creatinine. So you have your creatinine values measured. After that, softwares are available. From there, you can put that values and you will get the EGFR. So depending upon this EGFR, you will be categorized as stage 1, stage 2, stage 3, stage 4, and stage 5 chronic kidney disease. So this is by which you will detect, when your physician will detect. But how you will understand that your kidney is going to suffer, or you are suffering from diabetic kidney disease? That there are few signs or symptoms, like you are having leg swelling. So whenever you are moving here and there you will see that there is a leg swelling. But this leg swelling, when you lie down or you sleep, this leg swelling actually vanishes. This is normal. But when this leg swelling doesn't vanishes with your sleeping, or when you are not actually in erect position, that means this leg swelling is not going to disappear. That means you are having some problem in the kidney, maybe. Or in the early morning, you may have some problem of the swelling around your eyes. So that is called facial puffiness or the periorbital puffiness. So this is very early signs or symptoms of your or your kidney disease. So that may be because of the diabetes. Now, if you in the later stages, you may have your foamy urine. That means urine is containing more of foam. That is called foamy urine. So if you are passing more and more foam in the kidney, means urine, that means you are passing actually more and more protein. So this is very important sign that whenever you are having foamy urine, you should rush to your doctor to get checked by the doctor, and the urine should be examined. Then when it is advanced disease, then there are lots of signs and symptoms occurs. But this is not specific for the kidney. Say, for example, you may have some unexplained weakness. So you cannot explain with any other symptoms, no fever, nothing, but you are having weakness. That is number one. Number two, if means fatigue, that means you cannot have the capacity to work. Means you want to do some work, but you cannot. So this is unexplained fatigue. Next, if you are having some kind of shortness of breath, say you earlier you could easily climb stairs 2, 3, 4, 5, 6, but for the last 2 weeks or 3 weeks time, you are getting that you are observing that after 2 stairs climbing, you are having very much shortness of breath. In the particularly at night, you are having some cough, you are having some shortness of breath, your sleeps are disturbed, and after some time, this is normalized, and again you can have a sleep. So that is nocturnal dyspnea, that is called nocturnal breathlessness, could be a sign of your diabetic kidney disease, advanced diabetic kidney disease. Now, if the kidney disease has been progressed so much, you may have some itching in your body. So there will be generalized itching, again unexplained itching. You may have pigmentation, that means increased pigmentation or altered skin color. So it will be dark in color. That should not be. That means your family members are not having, but you are sometimes having altered skin color. Your hair may be fallen. So there is unexplained hair loss. So the nail color may be changed. That means yellow nail sometimes you can see in case of diabetic kidney disease. So there are lots of signs and symptoms through which we can have some suspicion that you are suffering from some chronic disease. Maybe it's a kidney disease. So you have to rush to your physician to be checked and to be detected that you are having some problem with the kidney.
Thank you so much, sir, again for so nicely explaining it to all our viewers. I'm sure they are getting so much information out of this session. So let us now move on to the advised or recommended treatments that are there for people who have been suffering with diabetic kidney disease. So, sir, what are the recommended treatments in India? Over to you.
So recommended treatment is a vast chapter. Rather, I say the number of chapters, and that actually is we teach in our DM curriculum as well as MD curriculum. So I'm just touching upon the few points. Say, if you are having diabetes uncontrolled, definitely that should be controlled. Okay, and the target set should be depending upon the stage of the kidney disease. Say in the when you are not having kidney disease, then the target should be less than 6 or 6.5. And with this, you may not have your kidney disease. Now, if when it's the advanced kidney disease, say your creatinine level is high, in that case, in the advanced stage of kidney disease, the glycemia, that is the HbA1c target, is usually around 7 or less than 7. So it is more or less to avoid the hypoglycemia. Another very important sign of the development of diabetic kidney disease is the recurrent hypoglycemia. I just forget in that means signs or symptoms of diabetic kidney disease development. That is, if you are having recurrent hypoglycemia, that means unexplained hypoglycemia. You are having very good control of the diabetes. You are very much religious about your medications, but suddenly you are developing a hypoglycemic episode. That means sugar is falling. So that could be a very early marker of your development of advanced diabetic kidney disease. So whenever you are having advanced kidney disease, the glycemia target should be around 7. If it is below than that, then you may have recurrent hypoglycemia and hospital admission is very high. So the first and foremost is the diabetes control. Next is your hypertension control. So I have already discussed about that. The target hypertension should be achieved and that should be controlled. Now, there are some certain medications through which this diabetic disease can be modified, and these also act as antihypertensive medications. So, these are ACE inhibitors or ARB. I'm just mentioning the name, that is ACE inhibitors or ARB, like Ramipril or Telmisartan. There are few common names I am just mentioning. With these drugs, the diabetes progression can be modified. So it can control the hypertension as well as modify your diabetic kidney disease. Can prevent the progression, even can stop the progression. In some studies there it is shown. So the hypertension control, but most importantly, the hypertension should be controlled. Next, some other newer molecules we are actually getting day by day. So one is the SGLT2 inhibitors, like called empagliflozin or dapagliflozin or canagliflozin. This flozin, I'm just telling you the name because you need to have a very good awareness about these molecules. We have to use more and more these molecules to treat the diabetes so as to prevent the progression of diabetic nephropathy or progression of diabetic kidney disease. Next, one new molecule you have getting is the finerenone. Just you remember the name finerenone, or your doctor will suggest you if you are having diabetic kidney disease. So first foremost is the sugar. Next is the hypertension. Next, your dietary modifications. That is the sodium level should be cut. So target sodium level usually set is the sodium chloride is less than 5 gram or if sodium is less than 3 gram. So that your dietitian can suggest you different diets through which you can cut down your salt intake in the body. Next is your water restriction, because in the advanced diabetic kidney disease, the water restriction is very important. Otherwise, you will develop heart failure and the hospitalization will be very, very high because of the shortness of breath. So the water restriction is depending upon your urine output. So the amount of urine that you are passing, that will determine your water intake. Say in summertime, we usually advise that if say 2 liters urine output, then you can add more 500 ml more to that. That means if your urine output is 2 liters the previous day, in the next day you can take 2.5 liter of water. But in winter time, it will be around 2.3 liter, 2.2 to 2.3 liter, because of the sweating will not be there in case of winter time. So the protein restriction. So protein restriction is very, 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 very important part, the integral part of the diabetic kidney disease or the kidney disease maintenance. So when you are not having any type of kidney disease, the protein recommendation is 1 gram per kg per day. Now, when you are developing diabetic kidney disease or any kind of kidney disease, the protein restriction will be there. That means it will be around 0.8 gram per kg per day. And when it is the advanced kidney disease, that protein cut down should be more, and if you can cut down the protein more, then the protein it is said that the progression of the kidney disease will be slower. But there is another paradox also. When you will take less protein, the more you will have protein breakdown in your muscle, so you will have wasting. Now there are lots of things are there, but importantly, the protein restriction should be there. Next, when you will have dialysis requiring kidney failure, in that case, paradoxically, you have to increase your protein intake in the body. So at that time, the protein intake will be around 1.2 to 1.5 gram per kg per day. So this is totally opposite to the means when you are in advancing stages of kidney disease, not the ESRD. So this is all about more or less your food, and definitely the DASH diet recommendation. There's a fruit that is permissible that you should take. The vegetables you should take as per the recommendation of the guideline, and less carbohydrate and the less fat, that is more or less recommended in the DASH type of diet that you should follow. So protein restriction, the glycemic control, the hypertension control, the different drugs that should be used, the water restriction, and then if you are having cardiac disease, that means heart disease, in that case the heart disease should be controlled. Otherwise, that heart disease will lead to more and more advanced kidney disease. If you are having problem with the liver, then that liver should be also be monitored carefully to be treated by your specialist, so that the liver kidney axis should be minimized or should be normalized. So these are the different other aspects. So if now you can ask the specific questions regarding the more advanced type of treatment.
Thank you so much, sir. So we have basically covered in entirety for public health awareness purposes, the different signs, the different symptoms, how to detect the condition early, and also the different types of treatments that are available that people should be aware of. So as we recently celebrated the World Kidney Day on 9th of March, for all the people out there who are watching this show, what would be your message for them to keep their health and kidneys in good shape and in good condition through their life?
Yeah. So as a nephrologist, we always mention that you should know about your kidney health. So you have to prepare for the untoward events that can happen to our life, and you should be careful what is happening to your health or towards kidney, to your kidney in current situation. So that was actually the statement that was given, the motto that was given in the last World Kidney Day. So if you consider the recent pandemic, that is the COVID, that actually hampered our life, our social life, and throughout the world, that actually hampered. So we have to prepare for the whatever thing that is happening to your life in recent future or a long distance future. We don't know, but you have to be very much careful and to be prepared. So as kidney, because if you are having diabetic kidney disease at the diabetes now, you may develop diabetic kidney disease after 20 years. And the figure shows that around 50 to 60% of the total diabetic population will ultimately lead to diabetic kidney disease. So if you are prepared about the development of diabetic kidney disease, so the affection, the economical affection or the social affection towards your 10 years or 15 years or 20 years life will not be affected so much, because you will be prepared. So you will have more, you will keep your money ready to treat your diabetic kidney disease when you are getting more and more advanced kidney disease, or the insurance coverage should be there to have this fight against the diabetic kidney disease. But the most importantly, when you know that you are suffering from diabetes, that diabetes should be controlled, the hypertension should be controlled, you should be regularly monitored by your physician. You should consult your nephrologist when you are having development of diabetic kidney disease. You should be stick to your exercise, your dietary recommendation by your diabetologist or the nephrologist. Your the smoking or alcohol or the other addiction should be minimized, and obviously the over-the-counter medication should be stopped, and definitely the Ayurvedic or the alternative medication that you are getting, that should be prescribed by a very renowned or the established physician in that say, so that the untoward side effects should not happen. And for your next generation, you should involve them to acquire this knowledge, so that in the recent means in the long distance, when you will develop this kind of picture, the next generation should be informed about this, and so they will be more prepared for this kind of diseases, the devastation. Okay, so that's all.
Thank you so much, Dr. Tanupal, for staying with us and guiding us through this very informative session under your expertise. So thank you so much for taking out your time from this valuable, from your busy schedule. I would also like to thank all our viewers for staying with us till the very end. I would like to thank our partner, JB Pharmaceuticals and Chemicals, for being our partner in this activity and for spreading awareness on this very vital topic on kidney care. So with that, we close out this session and stay healthy, stay happy. Thank you.
Thank you.